Hello and welcome to Medical Dialogues. I'm Preksha Garg. Today I'll talk about cannabis exposure linked to 1.5 times higher risk of unhealthy pregnancy outcomes. In a large study of more than 9,000 pregnant people across the US, researchers at University of Utah Health have found that cannabis exposure during pregnancy is associated with composite measure of unhealthy pregnancy outcomes, especially low birth weight, and that higher exposure is associated with higher risk. Compared to most prior studies, this study was larger and measured cannabis exposure more accurately, which allowed researchers to distinguish the effect of cannabis itself from those caused by other correlated health conditions. The research published online on December 12 JAMA.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
In the past 10 years, the percentage of Americans who use medical marijuana has more than doubled as state-level legalization becomes increasingly common. But despite its prevalence as a medication, the full health effects of cannabis remain unknown, especially for specific population such as pregnant people that might be especially at risk of health complications. The scientists found that cannabis exposure was associated with a 1.5-fold increase in risk. 26% of cannabis-exposed pregnant people experienced the unhealthy pregnancy outcomes versus 17% of non-exposed pregnant people. Higher level of cannabis exposure over the course of pregnancy were associated with a higher risk. A distinguishing feature of the study was how the researchers measured cannabis exposure. While other studies had asked the participants to report their own cannabis use, which has been shown to underestimate the actual rate of use by 2 or 3 times, the scientists measured the level of the metabolic byproduct of cannabis in participants' urine sample, which gave more accurate measurements of cannabis exposure. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.